My name's Erin White, and I am about to present a head-to-toe physical assessment. I am going to assemble all of my equipment. I have my stethoscope, which I'm going to clean properly. And I will let that rest properly to dry. Second off, I have my cotton applicator. I have a pen light. I have my hammer. I have a pair of gloves. Don't judge me, they're not the same. And a blood pressure cuff. I'm going to wash my hands. So I'm going to perform proper hand washing procedure. And I'm going to provide privacy. I came in the room and shut the door, and I'm going to ask my patient his name and date of birth.
My name is Mason White, and I was born on September 3rd, 2004.
Very good. Do you have any, and can I see your name armband when I'm doing that? Do you have any drug allergies or food allergies?
No, ma'am.
Good. Okay. This procedure is going to take 30 minutes. Is that okay with you?
Yes, ma'am.
Okay, good. All right, so I have a 13-year-old male. Vital signs, which I took previously. Blood pressure is 96/64. Pulse is 86. Oral temperature is 98.7. Respirations are 19, which I assessed radially for 1 minute. O2 saturation is 100%. His height is 5'9" or 69 inches. Weight is 105 pounds or 47.72 kilograms. So, Mason, if you could read for me a verse in the book.
Yes, ma'am. For God so loved the world that he gave his only begotten Son, that whoever believes in him shall not perish but have eternal life.
Okay, very good. And for your farsighted, could you please tell me what time it is?
8:30.
Thank you. So, if my patient had any visual acuity problems, I would use the Snell chart. So, going on, I am observing my patient out of bed, sitting up straight. His hygiene is well maintained. Appearance is well kept up. Skin color is pink, dry, and warm. His body stature is properly erect. No signs and symptoms of kyphosis, lordosis, or scoliosis at this moment. Nourishment assessment, just looking at him and his body type, he's well nourished. His mood and affect, his facial expression is appropriate for the situation. Hearing, bilaterally denies no hearing problems. Do you have any hearing deficits?
No, ma'am.
Okay. Speech is clear. So now I'm going to move on to a level of consciousness assessment. Can you please tell me your name and date of birth again?
My name is Mason White, and I was born on September 3rd, 2004.
Okay. And do you know where you, can you tell me where you are right now?
Lake Lure, North Carolina.
Very good. And can you tell me the month and year?
It is March 2018.
Very good. And who is the current president?
Donald Trump.
Very good. I'm going to do a memory test with Mr. Mason, and I'm going to tell you 3 words, and I want you to remember them, and at the end of the assessment, I'm going to ask you to repeat them. So the 3 words are going to be pony,
Pony,
nickel,
nickel,
ball.
ball.
Very good.
Don't need nickel. All right.
At this point of the assessment, I'm going to do the head and face. So I'm going to put my gloves on after I've washed my hands. I have not left the room. So, Mr. Mason, would you please face that way?
Yes.
Okay. So I'm going to inspect the scalp and hair and cranium. I'm going to look through the hair to make sure there's equal distribution of the hair. There's no infestation of any lice. And the cranium feels symmetrical. Okay, and Mason, could you turn towards me, please?
Yes, ma'am.
Okay, I'm going to observe cranial nerve number 7, which is the facial, taste, tears, saliva, and facial expression. Mason, could you please raise your eyebrows? Good. Clench your teeth and eyes. Very good. Wrinkle your forehead. Good. Smile for me. Very nice. Stick out your tongue. Frown. With your tongue in. There you go, frown. And puff out your cheeks. Puff out your cheeks. Like that. Very good. And all of these responses are within normal limits. For this portion, I will inspect cranial nerve number 5, which is trigeminal, which are the facial muscles, including chewing, sharp and dull facial sensations. I will use my cotton tip applicator. Mason, could you face me, please? I am going to do a series of 2 tests on your face. If you can close your eyes for me and tell me the sensation that you feel.
That seems hard.
Okay?
Sharp. Yeah, that's soft.
Soft. Very good. And now I'm going to palpate the temporal pulses and the maxillary, temporal, maxillary, and the frontal sinuses. All are within normal limits. In the eye portion of the physical assessment, I am going to test visual fields by confrontation, which is the peripheral, and central vision, which is cranial nerve number 2, which is optic sight. Mason, will you face me?
Yes, ma'am.
Okay. I want you to cover one eye. Okay. And you let me know when you can see my finger.
I can see your finger.
Okay.
I can see your finger.
Okay.
I can see your finger.
All right. Let's try the other eye.
I can see your finger. Now.
Okay.
And now.
Very good. All are within normal limits. Now I will test for corneal light reflexes. I will use a pen light to shine this in your eye. Okay. You can look at me. And the white dot is closest to the nasal side bilaterally in the same pupil position. So now I will assess for the 6 cardinal positions of gaze, which deals with cranial nerve number 3, which is ocular motor, cranial nerve number 4, which is trochlear, and cranial nerve number 6, which is abducens. Cranial nerve number 3 deals with eyelid and eyeball movement and adjusts the pupils and the lens of the eye. Cranial nerve number 4 moves the eyeballs up and down. And cranial nerve number 6 moves the eyeballs side to side. Now, I'm going to ask Mason to face me. Please follow my finger. All responses are within normal limits. Now I will check for PERLA, which stands for pupils equal round reaction to light and accommodation. So Mason, would you face me? Very good. All responses are within normal limits. And the normal size is 3 to 4 millimeters. Lastly, with the eye exam, I would report any abnormalities of the conjunctiva, sclera, corneas, or irises. And I would also inspect for red reflexes and vessels. Since I don't have a proper otoscope, I will go ahead and walk you through a ear exam. So first I'll inspect the external ears for tenderness. Do you have any tenderness?
No, ma'am.
Okay. The symmetry is good, the alignment is good, and it is intact. Secondly, I would inspect bilaterally the auditory canal for discharge or lesions. No reports of discharge or lesions. So next, I will manually palpate external ear and mastoid areas for tenderness, edema, or nodules. Good. Within normal limits. So now after my assessment, I would document that my patient has a normal tympanic membrane, which would include pearly gray concave. And it would show on the right side, the shadow would be at 5 o'clock. And on the left side, it would show that it would be at 7 o'clock. And now for any abnormalities, I would report for further testing. It would be done with a tuning fork test. The Weber vibration test is typically 256 hertz, and the Rhine test would be 512 hertz. For the nose portion of this assessment, I will inspect for any lesions and symmetry of the nares and the nose. Everything seems within normal limits. So for this test, I will check for patency for each nostril. So would you please, Macy, would you please turn towards me and close one nostril and close your eyes. Can you tell me what that smell is?
The Vicks Vapor.
Okay. And if you can close your other nostril. Very good. And tell me what this smells like.
Oh, that's coffee. Coffee beans?
It's coffee. Very good. So now I am, which I just tested for, which was the olfactory cranial nerve number 1. And lastly, for this portion of the nose assessment, I am going to examine the nasal mucosa to make sure it is clear and no lesions. So can I please see with my pen light? No lesions and nasal mucosa is clear. So for the mouth and throat portion of the assessment, I'm going to inspect Mason's mouth. First off, I'm going to check his lips, the buccal mucosa, the teeth, the gums, the tongue, the floor of the mouth, hard and soft palate, and the grade of the tonsils. So to check for mobility of the uvula and soft palate, I'm going to ask Mason to say ah, ah, and the uvula is midlined. Next, I will check for cranial nerve number 9, which is the glossopharyngeal, which deals with swallowing, the saliva, taste, and speech. So to check the gag reflex, I would use a tongue blade, which I do not have, and I'm not going to demonstrate for reasons known. But I will say that cranial nerve number 10 is the vagus nerve, and that controls smooth muscles of the GI tract and the gag reflex. So I'm going to ask Mason to demonstrate something here for us. After I tell you that I would check for cranial nerve number 12, which is the hypoglossal. That controls tongue, muscles, speech, and swallowing. So Mason, would you stick your tongue out and move it side to side? And close your mouth, please. And please repeat after me. Light, tight,
light, tight,
dynamite.
dynamite.
Very good. In the neck portion of the video, I will inspect the patient's neck for symmetry, lumps, and pulsations, and assess for any possibility of goiters. I will also inspect the thyroid gland while the patient swallows. So Macy, if you face that way for me. So I'm going to inspect symmetry, lumps, and pulsations, and no goiters present. Next, I will ask the patient to face forward and look to the left. And then I will auscultate with my stethoscope with the bell for any bruits. No bruits present. So now the patient will face that way for me. I'm going to palpate the preauricle in the front of the ear, post-auricle in the back of the ear, the occipital in the back of the head, submental under the chin, submandibular under the jaw, tonsillar under the earlobe, superficial cervical, which is the top of the sternomastoid muscle, deep cervical, which is the lower sternomastoid muscle, posterior cervical, that's behind the sternoid-mastoid muscle, and then the subclavicular along the clavicle. And also I would assess the carotid pulse and check the trachea. So if you could. Pulse seems, rhythm seems regular, not bounding or thready. Trachea is good. And then I'm going to check the range of motion. So I'm going to have the patient turn his head side to side. Okay. And then shrug your shoulders for me against resistance. And that is testing for cranial nerve number 11, which is the spinal accessory, moving the head and shoulders. For the chest and lung portion of the posterior and lateral, I will assess the patient's AP diameter of the thoracic cage. So in doing so, I would sit up straight, please. Mm-hmm. This is 1 to 1 to 1. So that would be 1 to 2, which is a normal finding. And also, I would observe the symmetry of the shoulders and the muscles. Plus, I will also assess for the symmetric expansion. So I'm going to have the patient face this way. And I'm going to put my hands on his back, thumbs together. Please take a deep breath for me to see thoracic expansion. Also, Mason, would you please say the word 99 for me?
99.
One more time.
99.
And one more time.
99.
Hearing a muffled 99 is a normal response for the tactile fremitus assessment. I will also assess for lumps and tenderness and alignment of the vertebrae. Next, I will auscultate the breath sounds in all fields. So Mason, would you please face me? So I'm going to auscultate the breath sounds. It's going to be a little cold. Take a deep breath for me. I would hear bronchial sounds in this area. Deep breath. Every time my stethoscope moves, could you please take a deep breath? And I would hear bronchovascular sounds in this area. In this area, I would hear bronchovascular sounds. I would hear vascular sounds in this area. So there are 6 on the chest. I'm going to go laterally. And last one. Very good. At this point, I would ask the patient to turn away from me so I can listen to all 6 sounds, breath sounds in his back, and 2 laterally. Deep breath for me. And I would go side to side to make sure the breath sounds are symmetrical. Two more. Last one. Good job. All sounds are symmetrical and within normal limits. For the heart, I would auscultate the heart sounds in all 5 locations. Mason, could you please face me? For rate, rhythm, and splitting of the S1 or S2, and also the presence of S3 or S4 or murmurs. So the first one would be the aortic, which is in the second right intercostal space, and I would hear S2 the loudest. I would listen to these sounds for 1 minute each. The second area, I would go to the pulmonic, and that is the second left intercostal space, and I would hear the S2 the loudest. Pulmonic would be the second to the right intercostal space, and I would hear S2 the loudest. Herb's point is 3 to 4 intercostal space, which the sounds would be equally intensive. The tricuspid would be the left lower sternal border, and I would hear S1 the loudest. And the last would be the mitral, would be the 5th intercostal space, left mid-clavicular line, where the PMI is, and I would hear S1 the loudest. No murmurs, everything's within normal limits. For the upper extremities, I will inspect him for bilateral symmetry, the arms and the legs. Observe skin characteristics such as color, lesions, and texture. I will assess him for dehydration by way of skin turgor. I will pinch the skin on the hand, and as soon as the elasticity in the hand snaps back into place, there shows no signs of dehydration. I will palpate for skin temperature with the back of my hand along the arms, neck, and abdomen and chest area. I will also examine his hands for clubbing. So I would instruct him to put your nails together, your thumbs together, and to make sure there's 160 degree measurement there. And then I would check for capillary refill on his fingers to make sure the blood return is within 3 seconds. I'll palpate pulses such as carotid, brachial, bend for me, brachial, okay, radial, and then I would test his range of motion for his shoulders. Move your shoulders up and down for me, and your elbows, would you flex? And then wrists and hands, go up and down. Very good. Then I would test muscle strength for shoulders. Go ahead and shrug and push against. Very good. Arms, and also for wrists and hands. No, I'm sorry. You're going to grab for grip strength. Squeeze as hard as you can. Very good. And it's equal and symmetrical. So for the abdomen, I would first off, Mason, could you stand up for me and lift up your shirt and sit down just a little bit. Well, that would be good right there. All right, his abdomen is flat. His umbilicus, there's no herniation. There's no pulsate. I would check for pulsations for such as a AAA. The symmetry is good in his stomach. You can sit down for me. Thank you. I would also observe for skin color, lesions, or textures as well. Do you have any pain in your abdomen?
No, ma'am.
Okay. So then I would auscultate in all 4 quadrants, upper left, upper right, lower left, and lower right for 1 minute each to hear bowel sounds. You can hear hyperbowel sounds, active bowel sounds, hypoactive bowel sounds, and absent bowel sounds. So I would listen to each one for 1 minute. Then I would palpate for abnormal masses in the abdomen and for tenderness and for pain. So for lower extremities, I would first off inspect for hair distribution, any signs of varicose veins, color of legs bilaterally, of course, any lesions, and the texture of the legs. Then I would assess for skin turgor on the lower extremities for dehydration. And then I would palpate for skin temperature and edema. And Mason, could you stand up for me? And put your shin up here so I can see. So if I had to palpate for edema, I would palpate up the shin. Okay, thank you very much. Then next I would palpate for popliteal behind the knee pulse. Then I would do posterior tibula, which is behind the ankle, and then dorsal pedis on top of the foot bilaterally to make sure that all pulses are symmetrical. And finally, for the lower extremities, I would check range of motion for muscle strength, and I would ask for an example of that would be the knees. I would ask him to bend his knees, ankles and feet to bend up and down, and also for the feet, I would have him, go ahead and give me your foot, Mason. Go ahead and press down on my foot, and then if you would push up on my foot bilaterally to make sure that both of those strength, for his strength in both feet would be symmetrical. For the neurological portion, I will do a series of tests to check his motor function. So Macy, could you face me? I need you to touch my finger with your finger and bring it to your nose. Okay, ready? Bring it to your nose. Very good. Over here. Very good. And that's a positive response. Next, I'm going to ask you to do rapid alternating movements, and that's going to just, if you stand up for me, and go back and forth from your hands on your legs. Very good. That was a positive, with a normal limit response. Next, I'm going to ask you to stand up, and would you just bend over so I can check your spine? Can you bend over any more for me? There we go. All right, so I'm just going to pull that up and check the contour of his spine, which is straight. Very good. You may sit back down.
Yeah.
And then lastly, I'm going to just check appropriation of your senses. So if you can close your eyes, I'm going to touch either your hand, your foot, your leg of your body, and I need you to identify which body part I touch. Okay?
Go. Knee.
Okay?
Knee. Left knee. Right shoulder. Right hand.
Very good. Okay? And then I'm going to check your deep tendon reflexes. So I'm going to take my hammer And if you put your hand up straight, okay, act like you're going to act like you're gonna flex. Okay, right there. Just relax a little bit. It's a positive sign. I'm gonna do tricep. Just relax your arm. Relax your arm for me. There's a positive sign. I'm going to do brachial radial. There's a positive sign. And then I'm going to check his patellar. Just relax your leg for me. There was a positive reflex. And then raise your foot up for me. Do Achilles part. Positive sign, I'm sorry. And lastly, we are going to assess the musculoskeleton part of the body. And if you could, I want to see if you can stand up for me. Just bend over and touch your toes. Very good. I need you to walk around the room for me.
Alright, I don't want to break any machines.
Okay.
Right?
Very good.
Yeah.
And if you can walk back on your tippy toes. And then walk on your heels for me. Very good. And Mason, can you please tell me the 3 words I asked you to remember in the beginning?
They were pony, nickel, and ball.
Very good. So that has concluded the head-to-toe assessment for Erin White. I appreciate you watching and want to say thank you to Mason for being my patient, and have a great day.
Have a good day, guys.
Me tonight.